Devastating. It's shameful.
Late night negotiations in Frankfurt could now undo health care protections for many in Kentucky's transgender community. With less than a half hour left before the deadline and the start of the veto period, state lawmakers passed House Bill 495. Now, the bill could ban using state Medicaid funds for gender-affirming care. Wave News reporter Logan Perrone explains why opponents are now upset. Logan?
Yeah, well, Jose, what was passed looks nothing like the bill that was originally presented, with new language being added just days before that vote. Those against the bill say they're frustrated over the process used to push it through and are concerned about the long-term negative consequences that it could have for many Kentuckians.
I know the hour is late. I know we're tired. I know we want to go home.
An 11th hour vote.
House Bill 495, as many in the Senate concurred in by the House, is finally passed.
Sending a bill with 11th hour changes to Governor Beshear. House Bill 495 was passed in the General Assembly in the final hour Friday night before the state's veto period. Chris Hartman with Kentucky's Fairness Campaign and other critics of the bill left frustrated.
It was the shadiest way that they could have possibly done it, to insert it at the last minute without public debate.
Originally, the bill was 3 pages and aimed to prohibit discrimination against mental health care professionals and provide more access to mental health care. More than a month after being introduced and within days of the veto period, House Bill 495 was drastically altered and stripped down in the state Senate. Just 1 page banning Medicaid funds for gender-affirming health care and undoing Governor Beshear's executive order that eliminated conversion therapy in Kentucky. Bill sponsor, Republican Representative David Hale, did not defend or explain the changes in committee Wednesday, rather paraphrasing the new text.
And that's basically it, sir.
The way that they've gone about it is intentionally disrespectful because they don't want to have the debate out in the public.
If the bill as passed goes into law, people using Medicaid to cover gender-affirming care will likely face a gap in their coverage. It will also protect conversion therapy in Kentucky, which Beshear called particularly harmful to LGBTQ+ youth. In a statement to Wave's sister station WXIX, Hill called Beshear's executive order government overreach. Hartman expects the bill to face legal challenges and says it's going to do more harm than good in the Commonwealth.
The reason that we're under attack is because we are winning. That's the challenge, that they're trying to strip away the protections that we've gained, and it's devastating for folks.
Now, one other bill that passed in the final hour was the controversial Senate Bill 2, which prevents inmates in the Commonwealth from accessing hormone treatment or elective surgery for gender reassignment. Logan Perrone, Wave News.